Welcome. My name is Dub Dries, and I am privileged to serve as Chief Philanthropy Officer for Providence St. Jude Memorial Foundation. Today's Meet the Experts webcast is being hosted exclusively for St. Jude's closest donors to give an insider's view of the latest achievements within our nationally recognized Neurosciences Institute, as well as exciting advancements being made across the region. I'd like to start by thanking and introducing our outstanding panelists who have joined us today. Laura Ramos is our Chief Executive of Providence St. Jude Medical Center, and she will be moderating our panel. Dr. Kiran Bath is a board-certified neurologist with certification in neuro-critical care. She also serves as co-medical director of Providence St. Jude's Stroke Department. Dr. Natalia Covarubbias-Eckardt is a board-certified physical medicine and rehabilitation physician with a subspecialty in brain injury, and she also serves as medical director of Inpatient Rehabilitation and Pain Management at Providence St. Jude. Dr. Bowen Jiang is a Johns Hopkins fellowship-trained neurosurgeon and complex spine surgeon. He is also medical director of Providence St. Jude's Neurosciences Institute. Dr. Eric Westbrook, also a Johns Hopkins fellowship-trained neurosurgeon and complex spine surgeon at Providence St. Jude Medical Center. And finally, Dr. Santosh Kesari, a board-certified neurologist and neuro-oncologist and medical director of Providence SoCal Research Clinical Institute. Thank you again for joining us. And without further ado, I'll hand it over to our Chief Executive, Laura Ramos, to begin the panel.
Thank you very much, Deb. And thank you to all of you that are joining us this afternoon. We are so honored and pleased that you are able to do so. But before we begin our questions, I'd like to first start with a thank you. Philanthropy has played an integral role in the growth of our program. And in fact, just a few weeks ago, we had an extremely generous donation made to establish St. Jude's first ever donor designated endowed chair position. And it just so happens to be for neurosciences. That donor currently wishes to remain anonymous, but we are eternally grateful for the generosity. I also see that Marion and Dick Joe have joined us on our webinar today, and I'd like to recognize them for their recent gift to the neurosciences through the John H. Grace Foundation. Thank you to the Joe family and to the Grace Foundation. Finally, I'd like to thank Mr. Joseph Florentino, who recently left his legacy at St. Jude by honoring us with a significant estate gift to the neurosciences. We are sincerely grateful. So thank you. And with that, we'll go ahead and get started with some questions to our panel here. Can you all paint us a picture of how St. Jude's neurosciences program has grown and evolved over time? And what has helped to accelerate our transformation to become a nationally recognized leader in this clinical specialty field?
I'll start with that.
Thank you.
So hi, I'm Dr. Bath, and I've been here at St. Jude's now since 2009. And St. Jude's was always a great place to work at and come to for patients as well. And in 2009, we first applied for our primary stroke center certification. I'd like to say it was because I joined, but that can't be true. And we were already collecting the data. We were doing all the things that we needed to do, and we did get our primary stroke center certification. And we did exceptionally well each time, every 2 years, that the reviewers came in. And in 2015, with the collaborative effort and of all the treating physicians, the neurology team, the administrative support, we decided to go for comprehensive stroke center certification rather than the primary stroke center certification. And we were the first non-academic community hospital to receive the comprehensive stroke center certification at that time. And we haven't looked back since. I think the wonderful collaboration of neuro-IR, our wonderful neurosurgeons, the ER physician engagement. It has worked wonderfully for us, and St. Jude's, along with the physician collaboration that we have from all fields and the administrative support, we've been able to do a great job and keep moving forward and upwards. So,
thank you.
I think with any neuroscience institute, you really have to have expertise from all different specialties, and we have that here. We have 5 neurosurgeons, and all of us specialize in a full gamut of both brain and spine conditions. We have neuro-oncology, we have rehab, stroke. Specific to neurosurgery, as me and Dr. Westbrook were the neurosurgeons representing here, along with Dr. Brad Noblet, Dr. Hector Ho, and Dr. Lars Anker. We have the latest technology when it comes to be able to do our jobs very well at the top echelon of technology-driven care. When it comes to the operating room, we have something called the intraoperative MRI, which is really the first in this whole region for us to be able to do delicate brain surgeries and then be able to get an image right there in the operating room without needing to have the patient go back into ICU, then get the image there, and then if there's a problem, have them come back to the operating room. Specific to spine, we actually are a national leader when it comes to minimally invasive and robotic spine surgery. We have been working with one of the spine companies to actually make us the leader in that field by not only training and education and research, but providing that care to our patients in this community. And I am really happy to tell you that we not only have the latest technology when it comes to that, but we are the only robotic spine surgery center as part of the Globus training program for all of California. And here you can see a picture of us actually doing one of these surgeries where we do a typical lumbar fusion, which sounds very scary, and a lot of people may have had this procedure, but now we can do this with tiny little incisions in the back, and the patients are actually off the OR table within 2 hours with minimal blood loss, and they're going home the next day after surgery. So with all these technological advances and the teamwork that we have here, I've only been here for about a year. I really do see a very bright future ahead of us.
Thank you.
And then in speaking to our rehab department, we have actually just celebrated 50 years of inpatient rehab at St. Jude, which I think is an amazing feat. And our program has grown greatly. We attract a variety of therapists with subspecialists in spinal cord injury, brain injury, stroke rehab, and we've attracted various physicians that also have these subspecialties to help us as well. Thankfully, with philanthropy, we've been able to raise money in order to purchase the 0G, which will be in our outpatient rehab in Brea, and that will be body weight supported technology to help our patients who have had strokes, spinal cord injuries, brain injuries, work with our therapists in a different way than they have in the past. And so this technology is very exciting. It's just one piece of what the future of rehab has for our program.
So thank you all for highlighting not only our journey here at St. Jude, but also components of technology and how you utilize that in caring for our patients. And, you know, moving just to the next area, neuroscience is exceptionally a multi-specialty, multidisciplinary field. And thanks to St. Jude's ability to attract world-class talent such as yourselves here at St. Jude, we're privileged to be able to offer very comprehensive care. And so I wonder if we might just be able to spend a little bit of time talking about, with your variety of areas of expertise and specialization, how that care coordination is coordinated here at St. Jude, and what might that look like?
So I guess I can start off again. So for my specialty in physiatry, most people don't know what we do until you meet us, unlike all of these others where you know what they're doing. So really what we help is optimize function. So a patient who's had any type of injury, whether it be a sports injury up to something as severe as a brain injury or a stroke, then we can help with their recovery. In rehab, it is very multidisciplinary. I cannot do my job without the therapists, the case managers, the nurses, all of these specialists here. We have different areas that we help with, and we work really well as a team. Something that I'm very proud of for our inpatient rehab is this is the first time that we actually received the designation by US News and World Report that we are ranked 40th within the nation in our inpatient rehab. And we are the only one in Southern California to have that designation, which is great. And then that just shows how much our therapists come with their A game in helping our patients recover as much as possible, and as well as our teamwork together. With our outpatient program, we continue to push boundaries. So for example, we worked together so well as a team that when COVID hit, we were able to quickly put together our post-COVID recovery program that no other location in our area could do. It's just, that's how well we work together. And then we also offer a variety of programs in our outpatient rehab, whether it be a wheelchair seating clinic, we have driver rehab, we have chronic pain programs. We really do have a plethora of programs that can help our patients.
Great highlights. Thank you, Dr. Kova. And I wonder, Dr. Kesari, if you might talk a little bit about your very specialized area and how you so beautifully coordinate that with so many of other expert physicians.
Yes, thank you. So what you heard earlier from Dr. Bath and everyone else about the history of St. Jude's and the physician engagement, physician quality, hospital quality, and the multidisciplinary nature of what a lot of diseases, including brain tumors, need, really made this a special place that attracted me 3 years ago to try to help build a brain tumor program here, focused around research and clinical trials. Now, medicine is changing all the time, and research is a driver of innovation and a driver of quality. And I believe that because I've been doing this for over 2 decades in terms of trying to find better treatment options for brain tumors. But, the expertise, the expert clinicians that we have, along with a great clinical research team and providing research options really at a community level really ups the game in terms of the options that patients can have without having to travel hours and hours. And so it's been amazing with the support of the Cancer Institute and Dr. David Parks, our neurosurgery colleagues and the neurology colleagues and everyone really, because these are complex patients that have from the inpatient to the outpatient care with imaging, pathology, the multidisciplinary tumor board meetings that we have. So it's really an amazing place. This is the same quality that as what we trained at Hopkins or Harvard or other places where, as a team, we come together and discuss the best treatment options and provide clinical trials for these patients. And so it's been really amazing and fun to be able to develop a clinical neuro-oncology program where we're providing state-of-the-art clinical trials to patients locally without having to drive 3 hours anywhere else. The success has been so wonderful that companies have noticed that with St. Jude's, as well as with the bigger network of Providence hospitals, that we are very competitive now with UCLA, with other academic institutions in getting more trials from phase 1 all the way to phase 3 clinical trials in a variety of brain tumors. Also, as a neurologist, one of my aspirations is to really help in brain recovery. So physical therapy, rehab, obviously safe functional surgeries, and obviously the treatments that we do, the radiation chemo can cause side effects. And optimizing that and improving recovery is very, very important. And we have trials in dementia and in stroke where we're using stem cells and innovative new devices and technologies that are really, I think, going to help patients more than we have in the past. And so we're really trying to innovate in a way that's going to help change the outcome for patients. And when I was a medical student, neurology was a very nihilistic field, but now it's super hopeful, including even brain tumors.
Mm-hmm.
We don't cure everyone, but we are making significant advances.
Mm-hmm. No, thank you for sharing that. And it's such exciting work, and we are privileged to here at St. Jude continue to not only retain exceptional physicians but attract the best and the brightest. And I love hearing the description of having a community hospital but really performing at that high tertiary academic level, which ensures that we have exceptional care here at St. Jude, and that our physicians and surgeons can feel that they are able to practice to the top of your your capability and what you guys have been trained to do. I wonder, Dr. Westbrook, if you might share, just recently joining us, we're super excited that you're here. I know that you stayed for additional period of time for additional study and training. So maybe you can talk a little bit about that.
Sure. Yeah. So I just joined, full disclosure, about a month ago. So I've been new to the team. I just completed my fellowship in complex spine surgery and spinal oncology surgery at Johns Hopkins. And so my experience in my first month here, one has just been, wonderful. And it's been really focused on, the inpatient experience that patients get here at St. Jude. And what I have really appreciated, especially compared to where I was training, like we've said, the quality of the care is entirely comparable in my mind, from where I was at Hopkins to here. But, there are advantages, I think, of being in a small community setting. In a larger institution, there's a lot of institutional inertia that has to be overcome in order to make something happen for a patient. And I think this is probably something, many of us who have spent time at these, institutions are familiar with, where you're dealing with a patient with an acute problem and you need to be able to act quickly. And sometimes it's hard to make that happen. And I've just been, so impressed in my first month, spending a lot of time in the emergency room here at St. Jude, just how collaborative everyone is. Everyone is just, putting everything in to take care of the patient. We can get all the relevant specialists on board, make a plan and execute it quickly. And then, transitioning the patient out of that acute emergency phase into the inpatient phase, and then, onto rehabilitation, seeing that all happen here in the system quite seamlessly, it really has been just a wonderful start to my career here.
Well, we're happy that you're here. It's very, very exciting. I think it's very clear and evident that we have a lot that we are proud of and really, have the opportunity to share with you today. But I wonder now, while we talk about the course of excellence, and clearly we are on just a fantastic journey, but what does the next level of excellence look like at St. Jude? Because while we are proud, we are on that journey of excellence, and we want to continue to make sure that we, year over year are accelerating and raising the bar for our patients and for our community. And what might that look like over the next, year, 3 years, 5 years? What's in our future here at St. Jude?
Yeah, no, I think the foundation is so perfect for us to kind of have the building blocks and then accelerate from there. I think when it comes to some of the cultural things that we already do have, this is something that I would love to see consistency going forward. And this is with the help, of course, the foundation and donors, to have that focus on technology and understanding that technology is what's going to drive our field in neuroscience forward. But it's not just about using technology, because we have to validate that technology and understand how it positively impacts our patients before we just say, hey, the newest toy is going to be the best toy. So I think going forward, our 3-year plan would be to further accelerate the tools that we as neurosurgeons have in the operating room to better take care of our patients more safely, in particular, intraoperative CT scans and better navigation systems, so we can perfectly place instrumentation and do brain tumor surgeries very safely. Of course, working very well with our neuro-IR colleagues to ensure that aneurysms and brain bleeds and strokes are being taken care of in a minimally invasive fashion. And then also focusing on the pillars that actually make academic institutions successful that we can copy here as well. Not just focusing on the clinical care, but also working with Dr. History and the rest of Providence, Southern California on clinical trials, on research, and on focusing the care continuum throughout this entire journey, so that when a patient does come into our hospital, they get streamlined through the care and they get to rehab, they get better, they get to clinical trials and all the newest research technology that's been available to them. And then we follow them throughout this journey once they leave the hospital as well. So I think in 5 years, I wouldn't be surprised if we're the Hopkins of Southern California right here at St. Jude.
So I love your vision. That's fantastic. I think that we all share that. I know, Dr. Kesari, there's so much work that we've already begun in clinical trials, and you hit on a lot of that. But also, you've all spoken about the technology, but also the minimally invasive approaches to care here at St. Jude. And I remember, it seems like it's already been a few years ago, Dr. Kesari, when we were talking about the neuroblades and what that role with your, from a clinical research, from neurology, but also in coordination and concert with our neurosurgeons. What might that continue to evolve into, do you think?
Yeah, as Bowen said, technology, there's always new technologies, new approaches, minimally invasive, less side effects that we can utilize. And that is medicine, that is continued evolving medicine and research. And so it's amazing that we have an intraoperative MRI. It's such a unique machine that's only available at the highest tier academic medical center. And we have it here locally. And NeuroBlade is also an amazing technology that can help, again, minimally invasive, help with eradicating tumors and necrosis. So these are things that are, just amazing technologies that we can do here because of our expert neurosurgeons. But it is really going to change rapidly in the next 5 years because there are a lot of other new technologies that are coming up, from transcranial magnetic stimulation to ultrasound for brain tumors, as well as movement disorders and stroke and everything else. So it's really an amazing time in the neurosciences to invest for research and for clinical care. Yes. And a lot of it is new technologies. And also, my favorite is stem cells. We're doing a lot of studies using stem cells for dementia and stroke, and we're seeing some pretty amazing results in a small subset of patients, but nonetheless, it really, the future is really bright, and research and technologies and new approaches are really going to change the game for all of our patients in the next 5 years.
Yeah, I couldn't agree more. We hear so much about what does personalized care look like, and personalized medicine, and so much of that has to do with the clinical trials. And I loved that Dr. Jiang also mentioned about the discernment process that this team puts forth before there is a piece of technology or an area of research from a multi-specialty standpoint. They come together and really, discern what is the right direction, what is this going to bring for our patients? How is this going to better the care that we are able to provide here at St. Jude? And I'm just really, proud of that discernment process, so that when we do come to our foundation, when we come to our donors, that you can feel confident that this team of experts has done their due diligence, and that it is really something that has been researched, and there's strong understanding of the important value that will bring to us. So I thank you for mentioning that, because I think it's really important that you all have confidence that this team isn't just looking at that next shiny object that's coming down the pipes, but really there's so much expertise and so many different areas of specialty that are making that assessment together. So I think it's pretty unique, and it's something that is prevalent here at St. Jude, and certainly in our neurosciences. But before we transition to some additional questions, I thought it'd be kind of fun to get to know you guys just a little bit. And so maybe you'd like to either share something about you, or a hobby, or what do you do when you are not here at St. Jude taking care of our patients?
So I'm a mom. I have 14-year-old. I'm trying to be a good mom to a teenager, which can be sometimes challenging. And I have 2 little boys who are 8. I like to paint sometimes. I do acrylics in my free time. And this year I would like to learn how to swim.
Learn to swim. Great.
Yeah,
okay.
I haven't quite gotten that yet. I will hand it over to you.
I am also a mom, but to a little younger, so a 2-year-old and a 4-month-old. So I am dealing with sleep deprivation. But in my little free time that I have, I like to ski. So I'm excited for winter season now that I can finally get back on the snow.
Thank you.
I have a dog. I don't have any kids. I have a very small dog, about 15 pounds, and I could teach you how to swim. I swam back in high school.
We are a team.
Yes, exactly. I swam back in high school and I played a lot of tennis, and I still do both of those activities pretty routinely, multiple times a week in my free time.
I have a 7-year-old daughter. She just started 2nd grade today, so I'm excited to see.
Adorable at
Yeah.
that age. Aren't they?
Yeah, super cute. So I'm excited to see how that goes when they get home. In terms of things I like to do in my spare time, I enjoy hiking, climbing mountains. I climbed several mountains here in the Western United States, Rainier, Shasta. My wife and I recently climbed Kilimanjaro, which was a lot of fun.
Oh, wow.
Yeah, it was a good time.
Be careful.
Yeah, no. I'm careful.
We
I'm
need
careful.
you.
I'm careful.
I don't have much of a life. I'm on Zoom all day. No, I have 3 kids and just busy, just hanging out with them, taking care of their activities, and trying to build a regional program and research. So.
And you're doing a phenomenal job at it. And it's just taking a quick moment. Obviously, these are very busy physicians who have very busy practices, but it's nice to see a personal side. We know you all have one, but the vast majority of your time is dedicated, and we so deeply appreciate it. I'm going to touch on a couple of the questions that were mailed in earlier to us. Dr. Kesari started to already hit on this one a bit. And that was a question. A recently published book called Projections describes using optoelectronic stimulation to study brain function. Do we engage in these studies?
Yeah, so that is a book by a Stanford scientist, a friend of mine's husband, actually, and a neuro-oncologist, actually. This book describes a technology that's very early stage, mainly used in animals to study the effect of turning on and off genes using light. It's a pretty amazing technology. It's not in clinic yet, but it could eventually, and it's probably being planned to be in the clinic to see how we can assess different brain functions. But that technology will eventually come to the clinic, and St. Jude's will be one of the first to use it. But there are a slew of other technologies that we're already using, transcranial magnetic stimulation. This focused ultrasound is a very interesting technology that we will get to eventually in the near future. There's various new versions of this technology that are going to open up the blood-brain barrier. So all the drugs that don't work right now for brain tumors, or for even Alzheimer's and MS and other diseases, they could potentially work if you open up the blood-brain barrier a little bit. So this is ultrasound. There's different versions of it. Even transcranial magnetic stimulation is just amazing. It's being approved for depression, peripheral neuropathy, and now we're using it in combination to help all kinds of other disorders and with variable results. So these are really amazing new technologies. And optogenetics will get there eventually. I see a future where I think it will have a utility in understanding brain function, especially in the OR, and maybe even outpatient as well. But what I also see is combining technologies, stem cells for plus ultrasound and transcranial magnetic stimulation. And some patients are doing that right now, and there's some interesting results we're seeing in individual patient studies. So it's like I said, it's an amazing future for combining technologies and even artificial intelligence and just gathering data about patients. And so as a region, as a system, the number of patients that we're seeing is going to provide an amazing amount of data for us to dive deep and figure out why certain patients do well, certain patients don't, well, what we can do better in the future.
Well, that's fantastic. I mean, the future is absolutely bright and so much on the horizon to continue to look forward to. Another question that did come in was, what are the risk factors for Parkinson's, and is there a definitive test now for Parkinson's?
I'll take that question. For Parkinson's, usually the risk factors that have been found most consistently associated, and it's hard to say whether they're causative or whether they're just associations, is growing up in a rural setting, more of an agrarian community. So whether it's exposure to pesticides or insecticides or fertilizers, nobody's really sure. But that is one of the risk factors that's been seen to be associated. And as far as testing is concerned, we do have the DAT scan, which is a nuclear medicine scan, which the ligand binds to the dopamine receptors in the brain. And that gives us an idea as to how much dopamine reserves we have. So it is a specific test for Parkinson's that is available now. And I'd like to add that that's one of the directions that I see our program going. We do have the expertise, we have the neurosurgical expertise, we do have research and rehab. We have a great rehab program for Parkinson's patients, and would like to expand that a little bit more in the coming years.
Great, thank you. I have another question that came in from our Q&A. When I experienced a TIA in 2005, St. Jude was not a certified stroke center, and there was a lack of neurologist specialization in stroke and cutting-edge technology. How is St. Jude prepared to identify and treat stroke today?
So I wasn't here in 2005, but starting 2009, we did become primary stroke certified, and we're a comprehensive stroke center since 2015. Stroke care, I think, is multidisciplinary. It's a multidisciplinary approach. So it's a very concerted dance routine, so to say, where every person has their own role and knows their own role. So from the moment a patient comes into the emergency room, we work as a well-oiled machine. So whether it's pre-notification from the EMS, from our EMS partners, to the ED that they're bringing a patient in, so we're prepared for the patient coming in. And from there on to early triage. Our triage nurses are all trained, and we're constantly looking at our times. Whether it's from door to ED physician evaluation, from door to needle, door to CT scan, we're always measuring our times and trying to better ourselves. And then there is the early notification of our neurologists, our interventional radiologists, neurosurgeons, if it happens to be a suspected intracranial hemorrhage. So we all work as a team, and we're constantly looking at improving ourselves. After the patient is evaluated in the ED, a patient goes onto the stroke floor where our nurses are stroke certified. All our ICU physicians, we do have 24-hour ICU physicians here. And all of them, I believe at this time, are neurocritical care trained. Mm-hmm. And from there, our patients, once their workup is completed and we've figured out what the possible etiology of the stroke is, go on to Dr. Covarubbias and team. And from there, it's decided whether the patient would go to inpatient rehab, and I'll let you take on from there.
So for patients who are at St. Jude with a stroke, we do have our physical occupational speech therapists that evaluate all of our stroke patients. And then if need be, then the physiatrist, myself, or our team would get involved and then decide where can they go. And really it is about optimizing their function. And again, we have the specialists. All of our therapists are very well trained and have expertise in this area. And if they're lucky enough to go home, great, then they can go home with hopefully some outpatient therapy, where we have a very great comprehensive outpatient stroke rehab program, or they go to inpatient rehab, hopefully, if need be. And there we have nurses that are certified in rehab, and then we have our stroke physicians that are rehab trained that help with the recovery as well. And our length of stay is very short. So all of the data points to really short lengths of stays within our rehab, and majority get discharged home versus to being institutionalized, say, at a skilled nursing facility. So we have great outcomes.
I think just a great highlight of that multi-specialty team that it really takes all of those disciplines to understand stroke care and be trained to be taking care of our stroke patients very, very well. One other question that has come in is, what effect has COVID had on the brain?
You can go first.
So we've had our numbers go up and down with COVID, and we saw a lot of acute COVID cases back in December, January, February. It's somewhat decreased. So one large patient population in this group is our stroke patients, because there's an increase in hypercoagulability. but also post-COVID, also there is other long-term side effects that we see. There's some difficulties with cognition. There's been cases where there are difficulties with ambulation, attention concentration. So the post-COVID care and post-COVID rehab becomes a very integral part of patient care.
Yeah.
And I think taking care of the patients right from the outset and any complications related to either vasculopathies or if they have lung or other multi-system involvement, taking care of patients at that point, going on to their post-discharge and recovery. All of that, we have looked at each portion of their acute COVID care and post-COVID care.
And just in case you have a question about, the vascular or the coagulopathy or, hyper that Dr. Bath was talking about, it just all has to do with the way that COVID has impacted the way that the blood, responds. And so just in case.
Yeah. And so with that, we've seen a variety of presentations. I'm sure you've heard of people that have been in the hospital, have been intubated, unfortunately, who haven't made it, all the way to the plethora of the patients that have been home, never hospitalized, and still have severe symptoms. So I'm working with our post-COVID recovery program in outpatient rehab. And like I mentioned, we are one of the first in the area to develop this program locally. And in talking with experts at other academic centers throughout the country, we're able to quickly establish this program. So we're seeing patients that have brain fog, difficulty concentrating, weakness, where they just don't have the energy to get up and move. So very similar to a fatigue or encephalomyelitis. We're seeing people that have difficulty just doing their basic activities. Also difficulty smelling, which we know about. People are having drops in blood pressure, high heart rates. They're needing to see pulmonologists. Also patients that have ongoing breathing issues who have never been in the hospital. And so our program has been responding to all of those patients, and we've been having some good outcomes. I think research is the biggest part of this. Unfortunately, we're still learning everything about how these patients are going to come out of these situations, and we don't have specific treatments at this time other than what we've applied to other patients with similar symptoms, such as cancer or who've had chronic fatigue syndromes. Those are the type of treatments that we're applying to these COVID patients, and it is helping for the most part.
It is interesting on the research angle that COVID is an inflammatory disease. It's just robust inflammation, and including in the brain. And cancer is an inflammatory disease. And actually many of the neurodegenerative conditions have low-level inflammatory conditions. And one of the studies that's being done here at St. Jude's at David Park is doing is an immunomodulatory therapy for patients admitted for COVID. That same drug, actually, we're doing a study in patients with dementia and also ALS. But interestingly, it could help. I think it could help with the post-COVID syndrome, whether it's lung inflammation or brain inflammation or all these symptoms of fatigue and cognitive dysfunction. There's an imbalance of the immune system, and this drug could help those patients. So I think where research and rehab and all the other treatments could really intertwine.
It's amazing. Well, thank you all very much. And I did just want to mention, as we're talking about COVID and how it has impacted so many, that we remain very, very aware and ensure safe practices. You may be noticing that we don't have a mask on right now. We have all discussed this because we are all vaccinated, and per CDC guidelines and appropriate spacing, this was considered an appropriate practice. But I did want to call that out should anybody have a question about that. But with that, Noreen and Deb, I will, unless there are more questions, I will turn it back over to you, Deb.
Thank you, Laura. This has been amazing. I do want to share that a comment came into the chat, and I'm not sure if all of you are seeing the chat. So this came from one of our very dear donors, and he said, thank you, Dr. Kasari, as well as Doctors Anchor and Park and the nurse navigator, Debbie Yoon, for all your efforts in treating my daughter who had a GBM tumor. So I wanted to make sure I passed that along. And with that, thank you all for joining us. And thank you to all of our speakers for making time in your schedules to engage with our donors today. And for those of you out there who, have gotten excited about what you've heard today and would like to speak with us about how you can help by investing in the continuation of this rapidly advancing program, please reach out to us at the Memorial Foundation. This is such an exciting time for our neurosciences program. And as you heard from our experts here, it's all about focusing on technology and research to drive our field and move us forward. So on behalf of our patients, physicians, and caregivers, thank you all for your continued faithful support of St. Jude and its life-saving, life-changing programs. Take care and be well.